Hello and good afternoon, everyone. Welcome to the Practice Pulse podcast. I am your host, Dr. Aditi Agarwal, and it is my greatest pleasure to introduce to you Dr. Eric Block. But before we get into who Dr. Eric Block is, I'd love to chat about what he does. Dr. Eric Block is a fellow dentist and someone who not only just practices dentistry and does it amazingly well, but also has managed to expand his horizons into teaching wellness and systems, and is also an author of children's books. I mean, he is truly an inspiration of how he manages to do not just dentistry, which in itself is one big chunk of what we do as dentists, but all these facets. He's such an wonderful, multifaceted individual. And really, it's a true honor for me to have Dr. Block on this podcast today, because all you dentists out there can really learn how he has managed to balance, and it has come with a lot of work being put into it. Balance, not just being clinical, but also being able to integrate all his various passions in being the individual that he is today. So thank you, Eric, and welcome again.
Yeah, thanks for having me, and it's been a pleasure to get back in touch with you. We met back in BU, a million years ago at the BU Dental, and then we got reacquainted several years ago, and it's been a pleasure to, consider you a friend, and also you're up to, amazing things as a dentist, a mom, you got a family, and then you also have this amazing software that you co-founded. So hats off to you as well.
Thank you, Eric. This, I think we are both individuals who have done so much inside and outside of dentistry that I am sure our listeners today, especially the newer dentists or the mid-career dentists that are getting burned out, would benefit to listening from what you have to say.
Mm-hmm.
So tell me a little bit about your journey and in dentistry, and then what led you to create your other facets. I know they kind of were birthed from the pains and struggles that you had as a practicing dentist. So let's start from the very beginning, as they say.
It started with a beer bottle, and I'll expand on that. But I'm from Massachusetts. I grew up in Andover, Mass, which is about 30 minutes north of Boston, and I went to Tulane University undergrad, and I graduated with a psychology degree. But while I was there, I didn't really know what I wanted to do. I thought, maybe medicine, maybe dentistry, physical therapy. But as I mentioned, I broke my number 9 central incisor on a beer bottle. And the next day, I had to go to a local dentist. This was outside of New Orleans because Tulane is right in New Orleans. So I went to a local dentist there, and I just loved how they patched me up and gave me my smile back. And I said, you know what, maybe dentistry is something I could do. So I finished up my prereqs and the DATs and applied and got into Nova Southeastern down in Fort Lauderdale and went to dental school down there. But I knew I wasn't ready for the real world. And I knew I wanted to get involved with dental implants. So I did a residency at BU from 02 to 04, and that brought me back to Massachusetts. And I then entered into the real world of private practice. And I've been practicing for about 22 years, but about just about halfway through my career, I went through a tremendous amount of burnout and, what you may call like a midlife crisis. And I just really regretted my decision in choosing to become a dentist, and was just really full of anxiety and stress, and was really burned out and wanted to leave the profession. And I thought about doing anything else, working in a cubicle, becoming a lawyer, because I was so unhappy with my uh, choosing of dentistry, and I was not enjoying myself, and I was, waiting until 5 o'clock to go home every day. I was waiting, for the weekend so I could decompress from the week. I couldn't even wait until lunch so I could go home for an hour. And I for sure said to myself, I can't wait until I retire so I don't have to do this anymore. And I said, I've got to do something here because this is no way to live. And
Mhm.
with my psychology background, I knew at some point that I wanted to go through therapy, but I finally pulled the trigger and picked up the phone and called a local therapist and started going to therapy. And we just dug into, me and why I was so stressed and anxious. And it was mostly up here. It
Yep.
was me putting too much pressure on myself, and me being a good old fashioned perfectionist. And I was a people pleaser and an introvert and all your classic signs of things that dentists are. And I realized that, originally I thought there was something wrong with me, like I just chose the wrong profession,
Mhm.
because the social aspect of the profession was just such a drain on me, to go from room to room and do all these hygiene checks, and give my patient in my chair a great experience, and and do this 8 hours a day every day. I was socially and mentally and physically exhausted. And what I learned was that this is just the way I tick. And I
Mhm.
also learned to not beat myself up when something didn't go right, when a crown didn't fit or a filling broke. And I got more comfortable in my own skin.
Mhm.
Um, and I realized that I was giving everything to everyone else, and not taking care of myself. And now, I really focus on myself, and through it didn't happen overnight, but time in therapy and a lot of other changes that I made, I was able to overcome my burnout and
Mhm.
get back to the point where I love dentistry. And there's good days and bad days, but I am happy I chose dentistry, and I wanted to share my story and show other dentists that may be going through the same thing, that you don't have to be miserable. There's a way, there's a better way. And that's when I wrote my first book, The Stress-Free Dentist, and the Facebook group, and just started getting out there and trying to help other dentists that may be going through something similar as me.
Yeah, no, I mean, Eric, you have done a phenomenal job in, as they say, turning a dentist's life around. I think a lot of dentists don't realize that we as dentists go through maybe two or three dentist life crises, right? And I wouldn't even call it midlife. I would probably call it our, when we are, say, about 7 to 10 years into our career. We go through one crisis, then we go through another crisis when you're about 25 years into the career, and then you go through another crisis when you're about to sell your practice and retire or do whatever you need to do with your practice. So we literally have these three or four crises moments in our own careers where we as dentists have to reinvent ourselves. And in these days, it seems like that life cycle of crisis seems to be shortening, because I think COVID has, taught. I mean, 2008 and the political as well as the economical. We are so affected by that landscape that a lot of dentists don't even understand that those landscapes affect us as well, because you have a trickle down effect that affects not only our patients but also staff. And so our problems seem to be compounding rather than reducing. And then how is it that we can find ways to help us continue providing the care that we want to provide to our patients while still maintaining some level of thoughtfulness, some level of um, even individuality, and being able to hold our own without basically without burning out, because then you become the universal giver. And as you said, right? And how do we stand in our truth, really, and provide the care that we want to provide without losing our mind? So it's definitely a very, very interesting discussion, and I think it's not had very often. People just focus on what's shiny and what's new. Clinically, every day there's so many new things coming out in dentistry, and there's a lot of analysis paralysis that happens because dentists are analytical people, right? And we then end up having all these choices that are put in front of us. And honestly, there's just confusion. And that also adds to the burnout, because you come to a point where how do you make a decision, really, that you think would be best for not just you as the dentist, but also your staff, also your patients. You're thinking about not just, okay, I'm going to get a new piece of technology or whatever it is, but how am I going to implement this? How am I going to adopt this? How are my patients going to accept this? There are like 5 steps that as a dentist you have to think of before you say yes, which is a very, very hard place to be in, because none of us have ever received any kind of formal training to really make those decisions after step 1, after saying yes to whatever it is, whether it's an intraoral scanner, it's a new implant system, or it's a new software. It doesn't matter, right? Whatever it is, how do we go about the next steps? So it's very, very interesting, and we are practicing in a very interesting time. So again, to the listeners out there, I am talking with Dr. Eric Block, who is a practicing dentist and also has his own podcast, The Stress Free Dentist, which is amazing. He is also an author of a few children's books and the co-founder of the Academy of Dental Life Coaches. So really, the guy with a lot of letters in the back behind his name. It's really cool and awesome to have you here today. So talk to me a little bit about, next leveling your dentistry. I know you talk about it in your book. So tell me a little bit about where that came from.
Yeah, and actually, you mentioned how things have gotten compounded, and you nailed it. Like for me, it was about 7 to 8 years in my practice, in my career, where I started to really, get kind of depressed and anxious and burned out. But I think you're right. It's things are happening quicker, and there was the pre-COVID and post-COVID world, and I have a lot of young dentists reach out to me, and they're just, you know, they graduated, they're maybe a year in, and they're regretting dentistry, and they thought it would be much better. They're stressed about, they thought they'd be better at crowns or class 2 fillings. And I tell them, look, your first 3 years, I compare it to like the minor leagues of baseball. You're not going to be good at first, and the bus is going to suck, the hotels are going to suck, you're going to suck, you know but you got to get better, clinically. If you hate crown preps, it's probably because you're not good at it yet, and things are not fun when you struggle with them. So really focus on those clinical skills at first. That's, I think, number one. And then from there, you gotta learn how to talk to patients and communicate and get treatment plan acceptance, and then you learn how to deal with staff. These things, like you mentioned, we never learned, but at first you got to really just master those clinical skills. And then for me, next level is really just I constantly try to add new techniques and technologies and treatments to my practice, and I'm always trying to reinvent myself and add new things, because I feel like you can get stuck in that hamster wheel of dentistry of just doing the same old thing over and over.
Mhm.
Um, and going next level could be something simple like adding a new, class 2 composite technique, or adding something big like adding sleep apnea to your office, or a 3D printer. But it's just constantly doing it, and doing it to make yourself enjoy going into work every day. To me, that's going next level. And we often didn't learn a lot of this in school, so we have to take
Mhm.
it upon ourselves to educate ourselves and learn these things. And then the other thing I want to piggyback on, you said that dentists are very analytical, and I totally agree. I think that a lot of us, we had a path. um,
Mhm.
Applying to dental school, going through dental school, it was all laid out for us. You had to take certain classes, you had to do well, you had to pass your state and national boards. If you didn't do well, you just study harder and take the next exam or the next competency to pass your requirements. But then you get into the real world and there is no path, and all of a sudden a lot of us are getting our first taste of failure.
Mhm.
A lot of us have been at the top of our class and got the best grades, and then you get in the real world and all of a sudden you got a bad review, or you have an upset patient, or you have staff that's fighting, or you have these uncomfortable conversations that you had absolutely no training in. And that can be really hard, and that was really hard for me.
Yeah.
And just being a leader to me is I something I struggle with, because I was not a natural born leader, and that's something I've really worked on. But to me, all these things, um, it takes time, but to me, that's what I call going next level.
Absolutely. Honestly, I think we are all following such a structured path for such a long time. And then you're literally thrown out into the wild, wild west. And you don't know whether you need a lasso or a revolver. You don't even know what tools you need really till you're in it. And when you're knee deep in it, it honestly, for a lot of us dentists, it becomes sink or swim. And initially you keep thinking it's your clinical skills, right? So obviously, yes, I have many a time it is the clinical skills, and that's why it is really important to get I agree with you, in the first 3 years specifically, for most new dentists, if possible, unless you have a really, really strong mentor, like somebody in the family possibly is able to mentor you, I would say really dedicate the first 3 years in honing your skills, meaning no procedure is too small for you, especially in the first 3 years, because the more you see, the more you learn. And I really firmly believe in that. And understanding that that's what's important, that's what it takes, and do what it needs as a newer dentist, newer grad, to what do you need to get under your belt to have that experience is, I think, key. And then as you progress in your career, that's when you start to understand what your strengths are really, and then it's really a lot about choices, and also a lot about understanding that even though dentists practice in isolation, we are not alone. And we have now, thanks to social media and, of course, a lot more connectivity than we had when we were growing up in dentistry in the first 10 years. There's so many more resources available to newer dentists today. And really tapping into those resources, I think, is very key, right? And creating systems. I wish somebody had told me that I need a system. Back when I struggled through opening my first startup, man, I wasted 4 years of my life, of my family's life, trying to systemize. And if I had systemized earlier, I would have been able to struggle way less than I did, 5 years into being in practice. So I know that you have also founded Flomo, which is a dental SOP system. So tell us a little bit about systemization and what helped you sort of come up with creating Flomo.
Yep. And just to piggyback also on what you mentioned about, the resources out there, a lot of it is free. You can go on YouTube, and if you're struggling with class 2 composites, go on YouTube. There's probably, 1,000 videos on how to do it. Or I love the idea of what you said, to find a mentor. Find a local, experienced dentist and ask if you can go shadow them. And I know dentists don't like this word, but practice on a typodont. I know you never wanted to do that again, but there's so many ways to get better and to do it for free. And then back to your question about Flomo. Flomo is a combo of words of workflow plus FOMO. So workflow and fear of missing out, FOMO. And it's a centralized hub in the practice to create and store all of your policies and workflows and documents and what I call, standard operating procedures.
Mhm.
And the reason I started this with my co-founder is that I was just tired of repeating myself all day. I was tired of being asked the same questions. I was tired of if a staff left, the painful process of training
Mhm.
them, or staff bothering each other to ask questions. So now my philosophy is, I do something once, I document it, and then I put it in the bank. I put it in Flomo.
Mhm.
And it could be something like, how I want my burrs set up, to the instruments I use for composites, to how I want the phones answered, certain scripts, to how do we process claims. So it's really everything we do in the office is documented. And
Mhm.
one of the eureka moments I had for starting this was, I had a legacy staff member that had been with us for 18 years, and they retired,
Mhm.
and a lot of this knowledge left it within her head,
Mhm.
and we were left scrambling to kind of, recover and pick up the pieces. So I wanted to get everything documented and all in one centralized place, so it's there for every staff member. So if a patient calls and has a question, then they can go to Flomo and all the answers are there. So it's like having all the answers to the test for the staff.
And that's incredibly helpful and beneficial for the staff to have a centralized place to go to, especially nowadays when you do have a lot of staff turnover and people are coming and going, for whatever reason. And it's always helpful so that they're not all, you're not always having to be there to answer all their questions. So that's amazing. That's really beneficial. Again, for our listeners who are tuning in, I am talking with Dr. Eric Block today, and he is a colleague, a friend, and a lot more than that. He has really diversified and opened up dentistry and getting into talking about wellness aspect of dentistry. So let's touch a little bit about the wellness aspect. And tell me a little bit about your experience as a coach, as a wellness coach, and also what you are seeing currently and what advice you have.
Yeah, so I co-founded the International Academy of Dental Life Coaches, which is a coaching organization, which is actually, there's two prongs to it. One, personally, as a psychology major, when I graduated college and what I was going through, I knew where to reach out for help and what to do. It was a matter of me taking action and doing it. But a lot of struggling dental professionals, maybe they don't know where to turn to. So that's one reason why I started the IADLC. Is you can contact us and we'll match you up with a life coach that can help you, whether you're struggling or if you're doing okay and you just want to get to that next level. A coach is a great thing to have to just improve your life and career. But we also wanted to create a community for coaches that help dental professionals. So if someone is looking for a second career and they're looking to get into coaching, then we
Mhm.
create a community to help coaches that are just getting started out, and connect them with like-minded peers. But to me, the most important thing for a dental professional is, first of all, realize if there's a problem, if you're struggling, if you're depressed, if you're burned out, to not wait,
Mhm.
because these problems don't go away typically on their own magically. So to reach out for help. And for me, I've reached out to life coaches, therapists. I've done hypnotherapy. I have
Mhm.
part of great, peer organizations. I've reached out to mentors, consultants, coaches. You know, just don't go into this profession alone. Like you mentioned, a lot
Mhm.
of us are solo practitioners and we're in our own little bubble and isolated, but you don't have to go into this profession alone. There's so many great, peers out there that and professionals that can help. So to realize there's a problem and then to reach out for help is really the second tip. And the sooner the better. I compare, and guys are the worst at this. We'll suppress our emotions deep down, and I compare that to like pushing a volleyball under a pool water.
Mm.
Like, eventually, you push that volleyball down, and then you let go, and it's just going to burst out. And that's when people hit rock bottom. They turn to substance abuse, alcohol,
Mhm.
suicide, you name it. You've heard it.
Yep.
Um, so the quicker you can reach out, the better. And you know what? You, you will be happier. And happy dentists are more productive dentists, and they have longer careers too.
Yes, absolutely. Absolutely. I'm going to do one last pivot and talk to you about going out of network to all those dentists out there that are, midlife, mid career dentists. I know that this is top of our minds because a lot of us are tired of, the reimbursements and all the games that we are constantly having to play. And of course, with the rising costs of everything around us. And I know that you have successfully done that in your practice. So congratulations to you. So tell us a little bit about how, anybody can, if they wanted to, is that something that you would one recommend doing? And what are the things they need to look at to even, see if this is feasible for for their practice? And this might be a podcast on its own, really, but maybe just a high level, talk about it, and then maybe we can have another conversation about this one because this one I think would be very interesting.
Yeah, and you're right about the rising costs, dealing with insurance. I think staff and insurance, one of the two biggest pain points
Hmm.
that dentists deal with, and the staff shortages, the rising
Hmm.
cost of staff, especially hygienists.
Yeah.
And I hear a lot of dentists say they're breaking even or sometimes losing money on their hygiene, and it's a lot of it has to do with being in network with insurance companies.
Hmm.
But I started to do this strategically just right after COVID because I had the time and we were at a major capacity issue, and
Hmm.
I dropped the two smallest PPOs that we were involved with, the two smallest percentage of patients.
Hmm.
And we saw that we could do it successfully. And that was because we had built great relationships with patients.
Hmm.
And then 4 years ago, I went out of network with Blue Cross, and that was
Hmm.
20% of my practice. And then 3 years ago with Delta, which was 50% of my practice. And again, we controlled the narrative. We did it very strategically.
Hmm.
Um, we focused on the quality of care and building great relationships with patients.
Hmm.
Um, we came up with scripts and we got the whole team on board, and it was a whole philosophy and culture change.
Hmm.
Um, it was not perfect. We made a lot of mistakes. We lost patients, but a lot of patients ended up coming back. But it was all about building those great relationships. But to me, I was at a capacity issue, and
Hmm.
I was running around with my head cut off, seeing 2 and 3 columns of patients. And I just said, you know what? enough is enough, and I want to strategically do this. But you got to be ready,
Mm-hmm.
and you got to get the team on board, and it's not something you do willy-nilly. You got to really be prepared for it. But it's one of the most re-energizing things I've done in my practice. And like, I could not go back to being in network, because it is just so nice to not have that barrier
Yeah.
of insurance in the way. And again, we focus on the treatment, the quality of care, and I couldn't be happier.
That's amazing. That's such an amazing and so heartening to hear, because everybody struggles. And like you said, I think a tiered approach and strategic approach is very important. It's very important and a lot of dentists out there sometimes do tend to do things in a void. We all want, because we do things under pressure, right? And I don't blame other dentists. It's I'm a dentist too. And some days I feel like, oh, forget it. I'm just going to tomorrow do this and, and hope for the best. But you're right. Some days, when those days are bad, you need to table that and say, okay, I want to do this. This is my intention, but how do I get there? And whether it is understanding, then really diving in and understanding what is going on. Peel your practice back like an onion, right? And see what is actually going on in the practice. Is it feasible? Is it possible? And always, and I think everybody forgets that no matter how stellar you are in the way you approach your patients, there will be a percentage of attrition. And I think understanding that and also making sure that you count that there might be attrition. And if so, how much attrition can you expect? At least, guesstimate it to as much as you can. I think that these are really important pieces of information that every and any dentist that is going out of network, and there's so much more. And I know that there is so much more that goes into strategically dropping insurance. And then also, of course, the team training, the staff training. I know, Eric, that you spent countless hours with your team, really just having them understand your vision first before they could even do anything in implementation. And please correct me if I'm wrong at any point or step, but I have not had the guts to go out of network yet. But honestly, I know you have, and that's really amazing, because I know that you've done it really beautifully, and you've got a great set of patients that value the care that you give. And I know that that's the most important thing for us as dentists. Is that's what we want that to be valued for what we do. And it is, truly, I think you are living your dentist dream now, in that career. And that's an amazing, but you've worked at it, and you really have built it in and structured it in the way that you want it to be. And not to say that if you can do it, others can't do it. And so that's kind of the messaging that we both as dentists want to give out there, is that, we have drastically different practices. We are, he's fee for service, I'm not, but we structure our practice the way we want it. And then we work toward building how we want it to really be a version of ourselves. So, thanks, Eric, for sharing all that. There's such great nuggets. And I know that we can do another podcast just on each individual piece. But if our listeners want to reach out to you and, learn more from you, how can they reach you?
Yeah, so I'm on Facebook, I'm on LinkedIn. You can check out thestressfreedentist.com. You can email me at eric@flomo.com, or ericmblock@gmail.com is my personal email. Yeah, it's been a pleasure chatting with you. And Just one final word is that, I still have ups and downs. There's still good days. There's still bad days. This profession is a marathon, not a sprint.
Yes.
But to realize that, guess who else has gone through a lot of these ups and downs? Every other dentist in the history of dentistry in the world. So, anyone listening out there, don't beat yourself up when something doesn't go right. It happens to all of us. So, Aditi, thank you so much for having me.
No, thank you, Eric, for really taking the time out of your busy schedule and coming on board and sharing the few pieces and the few pearls with our listeners today. So, thank you.